Hi, and welcome to the Pain Points podcast. I'm your host, Christian, and today we have the privilege of having Steve Wilson. Steve Wilson is the liaison for the Healthcare Alliance through the Painting Contractors Association. Steve, welcome to the Pain Points podcast.
Thanks, Christian. It's a pleasure to be here.
Yeah, I appreciate you taking the time. So, just right off the bat, we were talking offline a little bit. You don't actually work for the PCA. Like I said, you're the liaison. Can you describe your position? Tell us a little bit about your company,
Sure.
what you guys do, and how that affiliates with the PCA.
Sure. So I've been working with privately owned companies, small businesses for 25 plus years.
Hmm.
Almost all of that has been in employee benefits and HR consulting and things like that. And so with CBiz, the company that I work for, we're publicly traded and, all over the US. We're one of the largest employee benefits and consulting firms in the country.
Oh, wow.
Um, so we have, I have thousands of clients all over the country. Our company has thousands of clients. The company itself, it's mostly focused on mid-market.
Hmm.
And so by mid-market, we would mean normally maybe that 2, 3, 400 employee on up to 5, 10,000.
Okay.
Which, right, for painting contractors, there aren't a lot of 10,000 employee painting contractors, right? So
Correct.
what my team does, which is a lot of fun, is we take the things that we do as a company for larger entities like hospital systems and universities and really big employers that have a multi-state presence. We figure out how to take what they do using associations and translate that into something that small businesses can use. Right.
Nice.
So all businesses really are the backbone of the country. That's not just lip service. It's right, like 2/3 of all the new job creation in the U.S. comes from small businesses. All the innovation and patents that are created, most of that comes from small businesses, not colleges and not large corporations. So,
Right.
and they do all of that with a ton of headwinds, right? All kinds of things are against small businesses. And so we're able to, at least in one area, figure out a way to help make things a little easier for them and help them attract and keep good people through unique benefits offerings.
Yeah, absolutely.
So
And
that's
and when
how,
you're using the definition of small business, the Small Business Administration recognizes any entity with less than 500 employees as
right,
a small business.
right. And I would
So
even say micro business if we're going to use their definition, right? Because a lot of painting contractors, it's one
yeah,
guy,
the average
two
painting
people.
company size is one full-time owner operator typically, and a part-time employee. So we're looking at like 1.6 employees on
Right.
the average painting company size. So yeah, definitely the micro business, but that's really who we're here to speak to is that micro business. Like myself, I'm an owner operator. I've had W-2 employees,
Mhm.
one or two at a time. I've worked with subcontractors. So that's really who we're kind of speaking to here
Yes.
is right now we're just seeing that there's such a skills gap. But like you said, this is where job creation happens is in these small businesses
Right.
or these micro businesses. So how can the whole heart of inviting you on the episode today was to get your take on how an employer like myself
Mhm.
can do things to attract uh, good talent, quality people
Right.
in this market that we're in. So I did a little bit of research before the podcast. And in 2022, Gallup did a study, and also Indeed.com did a study. Gallup says that benefits and pay are the number one reason why job seekers are looking for specific employers.
Mhm.
And Indeed said that benefits is within the top five reasons why people are looking for
Okay.
specific employers. So when we're talking about benefits, what benefits, because there's a long list of different types of benefits
Right.
that an employer can offer, what
Right.
benefits is CBiz targeting with the Healthcare Alliance with PCA
Mhm.
and so that we know how to navigate the conversation.
Yeah. Excuse me. So, yeah, and if I'm coughing or dusty, I already confessed. I don't, maybe listeners don't really care, but I'm trying to fix a dryer in the basement. It's not going well. So I'm still coughing a lot of that dust out. But as far as the benefits go, CBiz, we can offer pretty much anything. Our conversations with PCA started well, they started a long time ago, but the first thing that we had rolled out was that health benefit alliance, which is a healthcare option. And since then, we've been able to expand that. So there's a number of different health insurance options. There are what we call in our business ancillary products like dental and vision and disability and life insurance offerings.
Okay.
There's also now retirement plan options that exist, and figuring out how to structure those is what we try and do. But it now
Wow.
runs that gamut. So it could be a
Yeah,
number of things, but
that
uh,
definitely seems like there's a lot to unpack
yeah,
with that. So, um, I think really what I'd like to try to focus on today, maybe we could even possibly split this up into other episodes if we get the request for that. But
sure.
today I really like to touch on the health portion
Hmm.
of the benefits.
Yep.
So I'm glad that you spoke about that. It's not just health insurance, right?
Right.
That there's also like dental, vision, which are typically like the common ones that a lot of companies offer, or that
Right.
employees are looking for as part of that benefits package.
Hmm.
And it's nice to know that through PCA that you guys are able to offer members things like retirement and things like that, which most of us don't even can't even wrap
Right.
our heads around at most times. Just trying
Yeah.
to make it from deposit to deposit at times.
Exactly.
So when it comes to, I know you said you had some slides to show. Maybe
Yeah.
we can do something like that now, because I really want to kind of get into the breakdown. Not, obviously, if people are wanting more detailed, um, we'll make sure that we give you the
Hmm.
opportunity to include your contact information towards the end of the show. But really, kind of a lot of there's going to be a lot of pushback on offering benefits from the employer because
Right.
of cost, right?
Yep.
So what does you had a great table here about wages and the wages only and then wages plus benefits.
Right.
Can you just give us a quick rundown of that?
Sure. And then, yeah, let me know if I know if this changes. Share that. So let me know if something popped up on the screen or not.
Yeah, it's loading.
Okay. Is it still thinking about it?
There it is.
Okay. Technology. Yeah. So when we're talking to business owners, especially the smaller ones, right? Then like you said, sometimes we just want to figure out how do we wake up in the morning and keep the electricity going, or right, be able to put fuel in trucks. So this was something that we had developed. Oh, geez, I don't even know how many years going back now, but it allows us on a company by company basis to really get in the weeds if they want to take a look at what the actual financial impact is to adding benefits. So it's really just part of your overall compensation. And
Right.
if anybody's interested in this, right, this is a little bit of an eye chart. When we give out my contact information, if anybody just wants access to this, just reach out to me and I'll send it to you. You can play with it and figure it out on your own if you want. Um,
Awesome.
but but the whole idea here really is just to show you that benefits really are structured in such a way, and it's only certain ones, right? Like health insurance and retirement plans. Those benefits give the company or provide the company certain reductions in their tax liability and other expenses that they incur because of wages. And so if you're able to design an overall compensation program for employees that includes benefits, what you see actually is that the overall cost to the business is lower,
Right.
right? And the employees actually walk away with more money. So let's say, right, you're getting ready to hire your first employee. You haven't gone down this road yet. You're trying to figure out, how do I design this? So all this table shows is, what's the difference between, say, a $22 an hour wage, and again, I know it's going to be different everywhere in the country, versus, say, a $20 wage and $2 spent in benefits, right? So
Hmm.
same overall cost to the business as far as what you're giving employees, right? It still amounts to $22 an hour,
Right.
but because some of the money is going to benefits, what happens is the company does not pay certain expenses, and those are listed over here. So, right, FICA tax, which is your Social Security and Medicare, that you don't have to match on those dollars, because the wages are actually, right, 20 an hour versus 22. So you're going to save that 7.65%. Your unemployment rate, whatever that happens to be, right, you're going to save on that for those dollars. The workers' compensation rate that you pay is going to be lower because the wages are lower, right? And then FICA tax, or I'm sorry, there's a FICA tax reduction when the employees run their benefits through, so you'll get an extra benefit. But that's really all this shows, right? So you could play
Yeah.
around with this, do different things. Again, I'm not sure how visible it is on the screen, but just to use crazy numbers, right? If you had $100 an hour versus $80 an hour, right? And then you would see that what ends up happening is the company's saving a couple $100 per week per employee,
Right.
up to $10,000 a year, right? And with lower wages, those amounts obviously are lower, but that's why it's important, because those smaller businesses, right? Those micro businesses, you need every penny.
Correct.
You need
Yeah,
it.
because it seems like this compounds because I mean, $100 an hour, that's one hell of a painter
Right.
to be paying, or you could look at that as an entire crew,
Right.
and how much you would be saving. And essentially, if I'm following, the difference is not benefits versus no benefits.
Mhm.
It's compensating your employee that you're paying them extra so that they can get their own benefits versus you providing benefits. So it's like employee funded benefits or employer funded benefits. And
Right.
at the end of the day, where the savings comes in is the extra tax burden because it's pre-tax versus post-tax. Is that correct?
Right. Correct. And so
Okay.
for companies that are just starting to think about hiring, right, then you can play with this. You can kind of find a balance, right? You look in your area to see what the going rate is for a painter. And again, just use easy numbers. Maybe it's $22 an hour, maybe it's 18, who knows? But then maybe you don't give them 18, maybe you give them 16, and you're putting two towards their health insurance.
Right.
And when you do it that way, even especially with lower wage employees, that has a huge impact on their bottom line as
Yeah.
employees at the end of the week, right? Because they're not paying FICA tax, they're not paying income tax, federal, state, local income tax on that money. They're getting full value for that. And then if you run the insurance program, and there's different ways to do this, but if you're running the insurance program that the employees are probably paying for anyway, if you just run it through the business, not only does it provide that expense deduction for the company, but it provides a big tax break for the employee, right? So they do go home with a lot more money at the end of the week, right?
Okay.
So because
So
they're not paying those taxes either.
when it comes to obviously with the new laws under the ACA, the Affordable Care Act that was put in place several years ago, um, is there? You keep going back to the $2 an hour benefit of health insurance. So essentially, what you're basing that on is a standard 40-hour work week. $2 an hour times 40 hours a week equals $80. Is that a reasonable size benefit package for an employee to carry $80 a week?
It could be. It really is. So I mean, again, think right now they have nothing, or
Yeah.
maybe they do, but the idea is if you're hiring somebody and they don't have a benefits program, they're paying for their insurance 100% out of their check, after taxes. So
Right.
anything you provide towards that, and the ACA's rules are really geared towards those employers that have 50 employees and up, right? In terms of affordability and what the company has to contribute. There are plans out there where you can be much more creative with your contributions. So there are plans out there where the company does not have to contribute anything at all. There are plans out there where you don't even have to you don't even have to sponsor a plan. You can just provide a dollar benefit to the employees so that they can go out and secure benefits, and everybody gets those tax breaks. So there's a whole array of different options that are out there for small businesses that they're just not even aware of,
Wow.
because these are usually strategies that are used in combination with other strategies at very, very large corporations, right? We figure out ways to impact all the different pieces of a health insurance program. And these are ways that we're able to do that. And then we're able to kind of peel those out of there, set them on their own, and let small businesses take advantage of those. So it's really kind of interesting what's out there now.
So
Uh,
obviously, it sounds like there is a whole gamut of options
mhm,
that are going to be curtailed or guided towards a specific company with either their financial or whatever their needs are, right?
correct.
So I don't really want to go down that path because it sounds like it's just so tailor made for each individual.
Right.
But what when you have an employer who's coming to you for the first time, what questions should they know the answers to, or what questions are you asking them to kind of be able to say, okay, well, we'll look at this set, or we'll look at this set based on what
Right.
your like what parameters should an employer at least give some thought to before contacting?
Right. So the number one thing that has to happen is that there has to be at least two people, let's say, and by that I don't mean um, yourself and a child or yourself and your spouse. It has to be maybe yourself and a business partner, or yourself and an employee, or two employees, right?
Okay.
So that's the first thing before we can even look at anything. And we do get a number of obviously sole proprietors that reach out hoping that there's something out there for them, and until we hire that first person, we're not a lot of help, to be honest.
Okay.
Um, there are some things that could be done, but so that's number one. Is there going to be a hire, or do you have an employee, or there's plans where we can even use 1099 contractors, but is there at least more than one person that we're going to cover? And then once we have that, it's really it's really just tell me who it is we're looking for coverage for, right? Is it two people? Is it 20 people? And if you can provide us that basic data, and we'll send you the little spreadsheet to fill out. But
Okay.
it's just, right, what's the name of the person? When was their birth date? What's their gender? And what's their zip code? And if we have that information, actually now through the Painting Contractors Association, we have access to technology that lets us search your area and pull up all of the options that exist, right? There is Health Benefit Alliance, which is a great option. It's not available for everybody in all areas, but when it works, it's great, and when it doesn't, it's nice to have other opportunities. But that's really all we need, and none of it is a sales pitch or it's heavy-handed forcing anybody into a benefits program. It's just simply showing people what's out there and having a discussion with them about that and answering questions. And a lot of times, this is just good information for maybe 2, 3 years from now when you're ready to do it.
Yeah,
Right.
absolutely. And the rates may change, but at least you know the direction that you're going to head, or
Yep.
at least be able to present that to um, potential hires throughout the application process.
Correct.
Because typically most places aren't offering benefits day one anyway, that
Hmm.
you're going to be looking beyond that probationary period.
Right.
Um, Now, with that being said, is that a standard practice, or is that a bylaw requirement as far as like having not offering benefits day one?
Oh, no, yeah. The only time you're required to have a benefit is when you're over 50 employees. Five.
Okay.
Yeah. Once you're at 50, you're supposed to be providing health insurance. And if you're
And you're
under
saying 50 employees?
50,
50, 50. Okay.
so
Uh,
So yeah, the Health Benefit Alliance program, right? Like traditional insurance, the problem is in the US, and there's a ton of reasons for this, but right, the problem is we have the most expensive health care
Hmm.
on the planet, right?
Correct.
No other country comes even close to the costs that we incur in America for healthcare. Right. That if you have an appendectomy done in the U.S., it might be $30,000. If you do it in France, it's I think 900. Right.
Oh,
Same
wow.
procedure, same doctors, same facilities. So things are very expensive here. I'm not trying to be political. I'm not pointing fingers or saying
It's the
it's a
facts,
very
right?
complicated issue. There's a number of reasons for it.
Yeah.
But the programs that are out there like Health Benefit Alliance, that one's designed as a response to those types of plans that are priced really, really high because healthcare is high, right? So they always develop these plans with high deductibles. You're not forced to offer plans, right? You're under 50, which is right where we're starting with the conversation.
Hmm.
But then, if you're under 50, you can still offer some of these plans. There are no deductibles. They're much more affordable, but they're going to be controlling the medical costs in a more unique way than say traditional insurance does.
Gotcha. Gotcha. So, kind of comparing to traditional insurance,
Mhm.
since you brought it up, um, how does a program like this, as far as like deductibles or
Yeah.
minimum spending and things like that, or what is actually covered, how does it differ?
Right.
Is it on a plan by plan basis? What does that
Mhm.
look like?
So yeah, the traditional problem again, right? We have very expensive healthcare. Insurance is very expensive. The primary way we deal with it, or the primary strategy for small businesses, is um, we raise the deductibles, right? So we have very high deductibles, which makes the monthly premium lower, just like car insurance, just like homeowners
Correct.
insurance, right? But then it's so expensive, even those deductibles are so expensive that it makes everybody feel like they don't have a health plan, right? So they don't go get care. Again, every state's different. It could be as many as 30% of the population avoids going to the doctor because they can't, right? They can't
Right.
pay that doctor's bill because they don't have the coverage. So
And deductible is your essentially it's like an out of pocket expense before the
yeah,
insurance kicks in.
exactly, right?
Okay.
You're paying monthly to have insurance, and all you're getting is a piece of paper that says, I have an insurance policy for that monthly amount. It doesn't do anything. And
Right.
then, right, then once you've paid the deductible, then the insurance starts to kick in, right?
Mhm.
And it does it at various levels. So Health Benefit Alliance, for example, which was the one we started with painting, the Painting Contractors Association, that plan, all the plans have the deductibles waived, no deductibles at all,
Oh,
right?
wow.
So you get coverage on day one, and you're just making a little copay, and a copay is if the doctor's visit's 150 or $250, maybe you pay 25 bucks or 40 or depends on the plan, right?
Right.
And then the insurance is paying the rest of that. So you have then affordable access to a physician, to a doctor, to a hospital. You're just paying a copay. You don't have to worry about deductibles, and the premiums are a little lower. Those plans are designed, though, for, I'm trying to think the best way to explain it. It's really designed for everyday use, and for employees that are typically going to be younger, if that makes sense, right? So the older you get, the more health issues you have,
Okay.
right? And the more you need the insurance, the younger you are. And again, I'm in my 50s. So if I think back to my 20s, I don't think I ever went to the doctor.
Right.
No, right. I'm healthy. If I did, it's because I was doing something I shouldn't have done on a weekend, and right, I got hurt, and then I need to, I had to go.
Yeah.
Right. So didn't need it. So you can get coverage that provides what you need to cover your actual lifestyle. Right. I don't need cancer protection at the age of 25. Usually, I don't need a hip replacement at the age of 25, 30, 35, or 40. I don't usually need that. Right. I don't need kidney dialysis. Not to say that there aren't issues that could come up. Right. There's
Correct.
kids, but it's so
But
rare.
again, back to the statistics of it, the likelihood at younger age is less likely for
Right.
those events to
Yeah.
happen.
So you
So
are, yeah. So you are
you
taking
would
a
say that
little.
at so when what you're describing now, is that curtailing it by company, or is that curtailing it by employee
The employee
within that plan.
decides. The employee decides what the coverage is that they want, right? So
Nice.
that Health Benefit Alliance platform has plans that let you go to the doctor a couple times a year, get access to basic medications, go to urgent cares, get free telemedicine, and that's it, right? So the example I
Wow.
give is from my own, like the second job I ever had was washing dishes in a restaurant. I spent a lot of time when I was younger in that industry,
Right.
right? So bartending and being a
Hmm.
waiter. In that industry, there's a lot of single moms, and what they do is they all coordinate their schedules, right? So one mom is home at all times with everybody's kids. Nobody has to pay for daycare. Obviously, this is way before COVID, but right, one kid gets sick, they all get sick.
Yep.
Usually the kids get better, but once a year, one mom calls in 20 minutes before her shift starts, says, "I'm not coming in. I'm at the ER with my child. She can't
Yeah.
breathe," right? And she's got her cold turned into pneumonia. So a plan like that provides access to care, avoids that problem, right? So mom's not in the emergency room, right? When she is in the emergency room, she's not coming into work. She's not getting paid. Her
Hmm.
bills are still getting racked, right? She's still got rent and food and everything
For
else
sure.
she's got to pay. And then on top of that, she's racking up a very expensive ER bill. So a plan like that actually provides somebody with access to care, right? You can get diagnosed quickly. Oh, geez, that's good. That's starting to turn into pneumonia. Here's your antibiotic, right? Quick prescription. I mean, it costs, might be free, might be $10, right? Everything's fine. Kid's okay the
Right.
next morning and mom's still at work, right? So it avoids a lot of problems from the business owner's perspective as far as having to pay overtime or, right, deal with scheduling issues if somebody doesn't show up because of a family issue. And at the same time, you're protecting the employee and the employee's wealth, I guess you'd say, or assets, or just their ability to meet bills day to day, right? So they're not forced to go, well, geez, maybe I need to get out of this industry, find something else.
Right.
That's the idea behind it. So from there, right, then the employees might say, well, I need a lot more than that. I need, I want to have access to MRIs, and I need extensive hospital coverage. And so in that plan, there are all of those options that range from basic access to care all the way up to full blown PPO style plan, right? And the
So
prices,
as an employer, I'm not having to sit there and have one cookie cutter model that's
right?
going to fit not only the current employees that I have, but also
Mhm.
speculating the future employees and what their needs are. Rather, they get to treat it more like a buffet, right? That
Correct.
if they want certain things, that they can elect, and obviously there's probably going to be a cost associated with that,
Sure.
right?
Sure. Yeah. Yeah.
But
But you're
based on
right.
what their needs are,
Yep.
the that monthly payment that they're going to be paying is much less. I think this goes back to your story, is
Mhm.
much less than the worry and anxiety of delaying care for a loved one that's
Mhm.
covered under the plan,
Right.
and
So
then the
yes,
eventual
you're
downtime or it getting worse, right?
right. So yeah, your
Yeah.
point, Christian, that like traditional plan might be, and it's different in every state, but we pulled one up this morning for a client in Connecticut, and it's almost $1,200 a month for just employee level coverage, and I believe the
Wow.
deductible was somewhere around $6,000 or $7,000.
What's the
Right.
point in having it?
I don't know. Right. And then so, but you have all kinds of coverage. But if you're, 28, 29, 30, 32 years old, do you really need all that coverage? I mean, how
Yeah.
often you go to the doctor? So there are plans in there for a couple $100 a month where you can go to the doctor two, three, four times a year, maybe five or six. You can get access to urgent care and basic medications and a visit to the hospital if you need it for a lot less. And as an employer, you are freed up to make a contribution that makes sense as a business. So you can say, I
Right.
can afford to give my guys $10 or $50 or 100. It's all over the board what different contractors do, but you pick typically a flat dollar amount, right? Because it makes it easier to when you're bidding on jobs, you know what your costs are, especially if you have to hire.
Right.
Right. So I'm going to pay out of your $200, I'm going to pay $50 of that a month, and the other 150 is on you. But it's still way more affordable. But then, yes, the downside is maybe that thing doesn't have, chemo in it, right? So if you're diagnosed with stage 4 lung cancer at the age of 30, you're not going to have that. What you will have, though, probably depending on the plan, is you'll have the ability to get tested early so that you catch it early and can deal with it early when it's a lot less expensive and a lot easier to treat,
For
right? And
sure.
you have a much better prognosis than, you know what, I can't afford to go to the doctor. I'm going to ignore this thing for another 6 months until I can't. And now all of a sudden it's stage four and I got 6 months to live.
Right. Yeah, for sure. And I mean, I think that's something that I never really consider. I'm in my mid 30s right now as of the time
Mhm.
of this recording, and that's something that you never really consider or think about. It's like I'm healthy today, so like why do I need it? But like if you if you have the right plan with the
Mhm.
right insurance, then you're incentivized personally, not even
Right.
financially, but personally, to go seek treatment as soon as it happens because you have coverage that's going to help you afford it, as opposed
Right.
to doing the ostrich treatment and just sticking your head in the sand
Hmm.
and just letting it go, let it go, let it go.
Yep.
That I mean
Yeah. I mean,
that's wild. Yeah,
I can't share personal stories, right? That's
for
not
sure.
allowed. But I mean, we have painting contractors that have, you know, the owners of the business have employees that now have health insurance. I'm aware of one where it's colorectal cancer that they identified early.
Wow.
So that person's going to get treatment and a very good prognosis. There was another that we were able to identify a hole in their heart and they were able to get surgery and get that treated. Right. So those things are a lot easier when you identify it quickly.
Yeah.
If you let it go, then yeah, it's a problem. And then yeah, the example, I mean, that is a personal one. That's how my mother went that way about 3 years ago. It was lung cancer because she ignored something for a long period of time, and when she finally did get it checked out, very advanced stage, they did 6 months worth of aggressive treatment for her. It was about $230,000, and didn't help. So
Yeah, and
um,
there's no guarantees, but again, back to the statistics and the likelihood of being able to either catch it early or to
oh yeah,
find ways for prevention,
yeah,
like that's huge.
yeah.
Wow,
Yeah. So
wow,
that program's really nice, but that's not always a fit for everybody, right? Sometimes the
right.
owner's 45, 50 years old. They want more comprehensive coverage. So sometimes those, you know, like Aetna, United Healthcare, Blue Cross plans that everybody's familiar with, sometimes those really are the best ones. So,
Now, another benefit to having benefits, pardon
mhm.
the pun, is that it helps with employee retention.
Oh yeah.
So now we have employees that are working for us longer.
Hmm.
So on your thought there is, um, if an employee starts off with you in, let's say, their mid 20s and they're there for their, you know, 10, 15 years, now they're, 40 years old, their health needs are going to change.
Sure.
With a plan like this, are they stuck in the same one?
No, they can switch every year, right? So
Okay.
maybe the business owner says, I'm going to contribute $50 a month. I'm going to offer four different plans. I'm going to have a base plan where, right, you get basic access to care. Maybe I have one that's a little richer in terms of hospital and testing. Then maybe the next one has even more hospital coverage and more prescription coverage. And then maybe I'm making this up. Maybe the final one is the
Right.
super expensive elite one. Right. So we offer that plan, and then the employee is they're stuck in it for a year unless something happens in their life, right? Like there's a birth or an adoption or they get married or divorced or something like that.
Okay.
But otherwise, yeah, every year they could pick a different plan if they wanted to.
Nice.
Yeah.
Nice. So how does the Health Benefit Alliance, how does that compare to like one of the MetaShare options?
Oh,
Are you,
Medishares, yeah.
so just for the people who are listening who are unfamiliar with it,
Mhm.
it's not insurance itself.
Correct.
You make a payment plan, or you pay a monthly premium to an organization, and then as
Mhm.
you submit all of your medical bills as a cash payer
Mhm.
to them, and then based on their guidelines, they reimburse you a portion or the full amount, depending on what the guidelines are for
Correct.
it.
So
A lot
yes.
of them are faith based, but
Mhm.
I'm assuming with your head nodding that you're familiar with these programs.
Oh yeah.
Um,
Yeah.
what are the advantages between having something like that versus having something a plan with the Health Benefit Alliance?
So yeah, each MetaShare is going to be different. Nothing wrong with them at all. We view them as really what are called claims accounts.
Okay.
So I'll actually share another screen. Not that anybody's super interested in the details behind insurance, but this, let me know when this pops up. It's just going to be a pie chart. Let me know when you see it.
Okay.
So it's got, I don't know, 8, 9 wedges in it, something like that. Did it
Okay.
pop up?
Yeah, it hasn't popped up yet,
Okay.
but go ahead. I'm listening.
All right. So if it does, right? So insurance premiums, there's a number of different components or pieces within that. And then one of those components is something called a claims fund. So when you pay
Okay.
your premium every month, the money goes to different pieces, right? Some of it goes for marketing, some of it goes for administration, some of it goes to pay taxes, right? So not everybody knows that there's taxes in their health plan. Some of it goes into what's called a claims fund, and a claims fund is just that. Like if I'm a MetaShare program, it's a bank account that all the money sits in, and when a bill comes in, there's somebody administratively that reviews that bill to make sure it's listed under the services that are covered,
Hmm.
and then they pay that out. The downside to it is there is no insurance. There's no large company behind that with an actual insurance program to support that in the case of a large number of claims that bankrupts the claims fund, right?
Mm,
And so that's the risk. There's always risk with everything, right? I'm not saying
correct.
these things are bad as long as they're run properly. It works out great. The only other downside that I typically hear about is it does sometimes, depending on the plan, take a long time to get your money back. So a lot of times you're paying the bills up front and getting reimbursed from MetaShare,
Correct.
and it can take a long time. Whereas with
Right.
this or HBA or any other insurance program, it's making the payments for you and it's doing it in a more timely fashion. And then it good or bad, right? MetaShare being a lot of them faith based, certain things they will cover, certain things they won't. There may be more things covered under a more traditional health plan than is
Right.
covered under a MetaShare. And
For
I don't
sure.
mean necessarily anything that's like a political hot button. It could be all kinds of things, but
No, I mean, and we're not here to go on one side of the fence or the other. We're just
right,
trying to educate people and let them make the best educated decision that they can. And
yeah,
really, this podcast isn't supposed to be. This episode's not supposed to be like a whole like deep dive into all of this. We're just
mhm,
really wanting to sample a little bit of everything and get people's curiosity for people who really our biggest target would be the minimum two-person company, right?
right,
That just thought that this wasn't a possibility, that
yeah, it
they
really
didn't
is.
think,
And there's
but there are options out there,
oh
affordable
yeah,
options that
yeah,
they could do, and it sounds like with the amount of options that are out there, it's more like a buffet, so you can get really creative with what you're drawing or what you're needing from what your needs are, what you're drawing from that, and then how it's
correct.
getting paid as well.
Yeah, yeah. So you have that health benefit alliance set pricing. It's got some things on the back end that aren't covered, but it's going to provide access to care. There are traditional health plans, which are usually more expensive, right?
Yeah,
But they're going to have the most complete coverage. There are plans out there that provide refunds to the business at the end of the year if nobody really uses it. Those are out there. There are plans called ICRA accounts, which you don't even sponsor a plan. You're just giving the employees a contribution. They go find a plan, right? That's probably the easiest way to do it.
so with a plan like that, thinking back to the first chart that you showed us,
Mhm.
um, would that still be pre-tax dollars?
Yes. Yes, as long
Okay,
as you set it up properly, right? So it's not
so
just you give them money because if you do
correct.
that, that's wages you're paying extra for it. Don't do, please don't do that. Please.
Right.
Like if
Right.
you're,
I just wanted to delineate
yeah,
that because that's where my
thank you.
mind
Yeah.
went first. But paying it with the pre-tax dollars, organizing it in the right way,
Hmm.
now your employee has not only do they have well, they have the freedom to find whatever's working for them, or
Hmm.
even better, the freedom to just continue the plan that they already currently have,
Yeah.
if they
Yeah.
already
They
had a
do.
plan, right?
Can be. Yeah. So
Yeah.
I'm already, I've got an Affordable Care Act plan and I'm paying $200 a month, but I've got an $8,000 deductible. Okay, fine. Maybe my employer is going to pay 100. I run that through the business. Now everything's pre-tax. My employer gets a break on all kinds of different taxes, and I'm getting a break on my taxes, and everybody makes more money
Yeah.
at the end of the day. So yeah,
Awesome.
smart way to
Awesome.
do it.
Now, I think my last major question, and we never talked about this offline
Okay.
for you, um, is what about mental health? We've been talking a lot about the
Hmm.
physical health, and as far as like catastrophic or just state, common colds and things like that, going to the
Right.
doctor visit, ER visits, and things like that. But in this day and age, we're in 2023, we're post pandemic. There's a lot of
A lot of stress.
there's a lot of stress.
Yeah.
There's a lot of anxiety,
Yep.
and in order to I once had the reason why I bring this up is because I once had an employer who said that they wished that they had a coat rack out front in the front door. And that way everybody could hang their problems on the door before they got to work. And then everything would be perfect, right?
Sure.
But the
Right.
problem is there's no such coat rack. People always have their issues and problems.
Yeah.
And as much as the culture wants to talk about work life balance,
Hmm.
if you get into a fight with your significant other on the way to work, you're bringing that with you to work. If your boss yells at you that day, or you
Yeah.
spill a gallon of paint on someone's carpet and you try to cover it over, like, you're going to bring that home with you. There's
Sure.
really, to have that separation isn't, it just doesn't make sense. I don't understand it. Like, I think
Right.
it's a fantasy land. But in order to provide a more holistic approach
Hmm.
to care for your employees, which I'm
Hmm.
not a certified mental counselor. I don't want to
Right.
be a certified mental counselor, but to be able to give them that option. Are there plans? Does the Health Benefit Alliance cover that?
All plans available through PCA have that coverage in
Awesome.
some form or another. Right. So
That's
whether it's the
amazing.
plans that provide a refund, right, you have access to psychologists, psychiatrists. The Health Benefit Alliance has a free 24/7 telehealth, but teletherapy option.
Right.
So it actually has both. So you can get, medical diagnosis over the phone, but you can also pick up a phone if you're in need of counseling or help, or it's a crisis. You can call somebody, and then there's even on the prescription side, even on the base option where there's free medicines, there's
Hmm.
a mental health medications program built in there where a number of the medications that you would see for things like bipolar or depression, anxiety, ADHD meds, those are
Right.
all included in there.
It's fantastic.
So, yeah, all the programs have that.
I think that's fantastic. I think there's so much focus spent on physical health
Mhm.
of our employees, or just of people in general. And sometimes because you can't see the the mental side of stuff,
Mhm.
that there's still a stigma around it when it comes to mental health.
Right.
So being able to have that option, being able to know that that coverage is available, I think is a great benefit
Mhm.
for employers to be able to offer their employees.
Oh, yeah. There's even
Wow,
a number of them with free screenings, right? So, alcohol abuse or risk screenings, depression, there's all kinds of stuff that's available in a lot of these plans.
that's so awesome.
Yeah.
Steve, this has been like drinking water from a fire hose, and
Yeah,
we've only scratched the surface.
yeah, we
But
haven't even begun to open yeah, but there's a
is
lot.
there, before we close, is there anything that I should have asked that I didn't ask?
I think it's great. And then if people are listening, they have questions and they reach out, and then maybe that's, reason enough for additional topics in the future. But no, it's the basics of how do you structure financially, how do you prepare for this, we have that resource. If you want it, we'll send it to you. We'll consult with you on it for no charge. We'll help you figure that out. And then when the time comes to pick a plan, you've got all kinds of things that are available now through PCA.
Yeah.
Health Benefit Alliance is a really good one. May not be perfect. There might be something else. But then the whole point of us is just to provide that large company support and consulting advice to a small business that doesn't have access to it. So
Nice.
just reach out. That's all you gotta
Yeah.
do.
Yeah. You don't know until you know.
Right.
So, and no, that's fantastic. Fantastic. Steve, how do people get a hold of you?
So I'm still doing this. I don't know why it still works, but you can have direct access to me on my cell phone. So it's 773-203-6104, or you can just reach out to steve.wilson at CBiz, CBIZ.com. And if I don't pick up, I'm right working with somebody else, and I'll call right back as soon as I can.
Yeah. Yep. I can attest to that. And I will be sure to include your contact info in the show notes so that if you're listening to this and you want to get a hold of Steve, and then just one caveat in order to, so any employer can contact you and get that free demonstration or the free initial consult. But in order to have access to the Health Benefit Alliance with the PCA, they have to be a member first.
Well, I mean, ideally, right? So we have to be careful with that kind of thing. And when it comes to health insurance, the way the deal is structured with PCA is I can still talk to you about it. It's still possible to get you in. Getting into that without being a member, it's still possible. So,
Okay.
but you really should. Come on.
Yeah.
You really should. But yeah, from a compliance perspective, when it comes to health insurance, you really can't say, unless it's a very specific type of plan, I really can't say to somebody, you have to do X before you can get in. It's against
I
the law.
gotcha.
But there's certain types of plans out there where you can do that, like captives and certain things, but that's not what we're looking at here.
Gotcha.
Yeah.
Awesome. Awesome. Well, we'll definitely include that in the show notes.
Okay.
Steve, if you wind up getting any feedback from people reaching out to you on this podcast, please let me know. I'd love for us to be able to just have this platform to just answer these questions in mass, so you're not having to have your phone blown up over these types of things. But don't let that hesitate you from reaching out to Steve directly. I really appreciate the time. I hope you get your dryer fixed.
Me too. My clothes are wet.
Yeah. And Steve, really appreciate it, my friend.
Thanks, Christian. Have a good night.
Yeah.